So here we have got an MRI hip scan of an elite athlete patient. The patient is a 27-year-old male and he has been complaining of a pain in his right groin. He had got similar pain in the right side about 5 years back, and actually while having exercise or throwdowns he experienced severe pain and had been suspecting some right-sided inguinal injury, and for which the scan has been sent. We'll just see the scan right now. So we have got axial T2 images. So the scan has been centered obliquely so that the inguinal region and the pubic region is accentuated. That's why we'll be able to see the anatomy better. So while we scroll from upwards down, we are seeing this is the rectus abdominis, and this lateral aspect is the external oblique muscle. So it should go down inferiorly and should extend up to the level of pubic symphysis, extending onto the pubic tubercle and inserting onto it. The external oblique itself ends by forming the superficial inguinal ring, superficial wall of the inguinal canal, and ends at the inguinal ring, and the posterior aspect of the inguinal canal, which is formed by the transverse abdominis and in the internal oblique muscle. So on the left side we have got the patent superficial inguinal ring, which is seen as we go inferiorly. This is the anterior wall and this is the posterior wall, and if we go downwards we have got this spermatic cord which would go down along this. That's how we can trace it. So on the right side, when we are seeing this, we are not able to see the definite delineation of the anatomy like we see on the left side. So there appears to be some ill-defined fluid in this region. As we trace back upwards, we see that there is definitely a fluid collection here, and in the region of the expected external oblique right-sided muscle, we are not seeing this muscle well. So if we trace all the way back up, this is the superficial part, this is the superficial scan, and we are seeing the muscle here, but as we go down we are not seeing the muscle. So this would be the tear of the external oblique muscle, which is extending inferiorly in the form of tear of the interior wall of the inguinal canal. So here there is a pseudo hernia defect formation, because of which the fluid here is seen tracking along the spermatic cord. So this is the right-sided spermatic cord, and here we see that the posterior wall appears slightly swollen, slightly thickened. However, it's not entirely torn. So the injury appears to be mainly in the region of the anterior inguinal wall. So this is the scan which we comment on based on the T2. So now we'll just confirm it on this image, GRE sequences, which will help us demonstrate the anatomy a bit better. So here we are seeing that the rectus abdominis, we have got the two heads. One is the lateral head and one is the medial head. On both the side we have got one is the lateral head on left side, medial head on the left side, medial head on right, and lateral head on the left side. So all the heads of the rectus abdominis muscle appear to be intact. So there appears to be a singular tear of the external oblique on the right side, and this tear is the reason of the pain in this patient. Thank you.